Hello, I'm Dr. Manasa. I'm consultant ophthalmologist at PRS Hospital, Trivandrum. So today we'll discuss about intraocular lens implants. These are implants that are placed in the eye after cataract surgery. So this video is for those who have a defective vision and that was diagnosed to be due to cataract by your eye doctor. This defective vision can also be due to other conditions like a glaucoma, a diabetic retinopathy, or a corneal disease. So this video is not for those patients. This is for those who has defective vision only due to cataract and cataract surgery was advised. Now, what are intraocular lens implants? So there is a natural lens in the eye. With age or due to some other diseases, that can get clouded when we call it cataract. So we remove that natural lens and we place an artificial lens in the eye known as the intraocular lens implants. These are customized implants, meaning the power of the implant varies from person to person depending on the dimensions of the eye. The standard of care today is phacoemulsification or femtosecond laser-assisted cataract surgery, where the incision size varies from 1.5 to 2.5 millimeters. Those are very small incisions that take less than 24 hours to heal. So we use foldable implants in those cases. So in this video, we'll be discussing only about the foldable implants placed through this small incision. Intraocular lens implants are designed to correct vision at different distances, but there are two things to keep in mind. None of these intraocular implants is as good as the natural clear lens that we had probably when you were younger. And also, all of these implants will provide a better vision than that with your cataractous lens. So these are two things that you have to keep in mind whenever you're going for the cataract surgery. Now, let us understand the myriad of options of the implants available today. The first one are the monofocal intraocular lens implants. So these are implants with a single focal point. That is, they can correct your vision either for distance or for near, but not both. So normally, we use these implants to correct the distant vision, and the patient might need to wear glasses for near activities like reading or using mobile phone, stitching, etc. Now, if using glasses was never a problem for you, or you don't aim for spectacle independence after cataract surgery, then monofocal implants are the suitable option for you. There are multiple reasons. One, they are time tested. They have been there in the market for quite a long time. And they provide good vision even under low lighting conditions, thereby improving the overall quality of life. They are affordable, but there are few disadvantages, like maybe you have to depend on spectacles for near activities, as I have mentioned earlier. Now there are newer generation of monofocal implants known as the enhanced monofocal implants. These are essentially monofocal. They correct for the distant vision, but they can also provide some degree of intermediate vision. That would mean some degree of spectacle independence can be assured. Still, you might need to wear glasses for very near activities. Now let's go to another section where we can label them as lifestyle implants. These are implants for those who aim for spectacle independence after cataract surgery. So the first category will be the toric intraocular lens implants. So if you have a refractive error known as astigmatism that arises due to the difference in the curvature of the cornea at the different axes, then a conventional monofocal implant may not be able to correct the vision at any distances. In those cases, your doctor might advise a toric intraocular lens implants. These are implants with the cylindrical power inbuilt in them. So you don't have to wear glasses for the cylinder power. And now there are patients who want spectacle dependence for distance as well as for near. For those patients, we have two options. One is the multifocal intraocular lens implants, and the second one is the EDOF or the extended depth of focus intraocular lens implant. And if you have an astigmatism along with that, then you might have to go for a multifocal toric or an extended depth of focus toric. Now, all of these implants come with an inbuilt UV filter and a blue filter to protect the eyes from the blue rays and the UV rays. Now, I would also like to add this. However premium the implant is, the lifestyle implants that I have mentioned, there are a few things to keep in mind. One, they might compromise on the contrast sensitivity. That means under low lighting conditions, you might have some degree of difficulty. The second one, other visual phenomena like glare and halos are more common with these lifestyle IOLs. So if you're a driving enthusiast who's keen on going for long drives at night, these premium implants might not be a suitable option for you. So you have to make sure that you discuss with your eye doctor before choosing the implant. Now, before concluding, let me also discuss few myths related to the intraocular lens implants. Number one, the implants have a shelf life or an expiry date. That's not true at all, because once implanted in the eye, they are meant to last for a lifetime. Second, once these implants are placed in the eye, you need not wear glasses. As I mentioned before, there are implants that can guarantee spectacle independence, but not all implants are like that. Third, doing the cataract surgery and placing the intraocular lens implant is a very risky thing. As with any medical procedure, there are risks involved with cataract surgery as well. But this is one of the most safest surgeries performed in the human body worldwide. The fourth myth, I can choose an implant for the time being and then decide and change it later. That is a very risky thing to do. So unfortunately, there are circumstances where we exchange the implant with another one, but in the normal situation, we don't prefer to do that. So choose your implant wisely before cataract surgery.